The world's largest economy, the United States, is now the epicenter of COVID-19. This as it surpasses 120,000 infections and more than 2,000 deaths. India, with a large population, has enforced a nationwide lockdown since Wednesday. However, this move has caused havoc among migrant workers and the congested transport system. Right now, I'm joined by independent journalist in New York, Pavni Mittal, for some perspective on the different approaches taken by these countries and also maybe what South Africa can learn from these different approaches. Pavni, very good morning. Thank you so much for joining us. First of all, let's talk about the United States and New York, which really is the epicenter of COVID-19 when it comes to the United States. And then you've got your president, Donald Trump, saying he may he's considering an enforceable quarantine, basically quarantine over New York and New Jersey as well.
Well, actually, we just got some breaking news that he has kind of reversed that, because earlier in the day, the New York governor really said that this was not going to happen. But what Donald Trump did do was that he asked the CDC to issue strong travel advisories. So as of now, people in New York have been advised to not undertake any unnecessary domestic travel. And a lot of states have said that if someone does come from New York, they should sort of self-quarantine. Now, that's a very different approach than what's happening in South Africa or even in India, where there is a complete lockdown. So there is no question of any kind of travel.
Okay, so the approach at the present moment in the United States does it seem coordinated, because you've got 50 states with basically 50 different healthcare systems there?
You know, I think that's a very pertinent question, and unfortunately the answer is no. The president has come under a lot of criticism, first for denying the fact that something like this is even happening, for being slow tests. He recently dissed a request from governors saying we need tens of thousands of ventilators. He's been tweeting things that are contradictory, saying that, we can open the economy by Easter, which is just like a fortnight away. And but this is a time when you're seeing a lot of local leadership really rise up. The governor of California, who has a shelter in place in Northern California. In New York, Governor Andrew Cuomo, who until recently had been heavily criticized for various reasons, for his political stance on things, has now, people are asking him to actually run for president because, his television briefings are incredibly empathetic. He's a strong leader. He said things like, I take personal responsibility. I will do anything. He's finding creative ways to address the problem, like getting hospital beds set up in, hotels, dormitories, convention centers. And he has been talking about, how he's dealing with the president. But, to answer your question directly, there is a complete sort of, in some cases, there's been complete disconnect. But, U.S. is a strong federal government. Yeah. So we're hoping that the state can do that. The other thing the governor did point out, and this is really the worst thing, is that now states are scrambling to get ventilators and are actually outbidding each other. So if a ventilator costs $25,000, New York says 30, California says 35. So states are actually not even working together. And that's something that Governor Cuomo has been hitting out against. He's saying we should work together, address New York first, because we're going to have a higher and a sooner peak. And then I will take personal responsibility to move equipment and personnel across the country.
Now, Pavni, I want to talk about India. It's in its fourth day of a national lockdown with heavy restrictions. This is a nation of 1.3 billion people. It's difficult to control. Is the lockdown working, firstly? And the government has also been accused of lack of transparency. The police have been accused of being very brutal, especially with the poor.
It's very hard to say it's working because India doesn't have that many cases, but India is not even testing as much. A lot of people are saying that, look, we need to do this. We need to stay ahead of the curve. We need to, really control it, because the people who are the most vulnerable, the poor, people living in villages, they will be hit the hardest because they don't have access to healthcare. There are villages where you don't have healthcare. So, a lot of people are saying this was necessary, but the criticism is that the implementation has actually made situations pretty worse for those vulnerable people. And I'll tell you, I was reading this article about, a vegetable vendor, and a lot of the migrant workers are saying that, we might die of hunger before we die of coronavirus. I'll give you an example of what's happened. So you've had this lockdown. It's being enforced, like I believe is happening in parts of Africa as well. Now, the police has been accused of actually beating up vegetable vendors and fruit sellers who are basically trying to feed people. And our migrant workers are saying, look, we have nowhere to go. We've lost our jobs. We live in a one room with 5 other people. We have to go home. So many of them have walked thousands of kilometers. And then the government said, okay, we'll make some arrangements, so some buses, and then hordes of them basically crowded around the bus station. So it defeats the very purpose of social distancing. And the fear now is that what if these people who haven't been tested, by the way, take the virus to places that don't have it yet?
All right, thank you so much. Interesting chatting with you. Pavni Mittal, independent reporter, talking to us from New York, giving us a perspective of what's happening in the U.S. and also what's happening in India right now.